An oculoplastic surgeon is a subspecialty of ophthalmology, so I am a board-certified ophthalmologist. But after finishing the full residency in ophthalmology, I went on to do 3 additional years specializing just in facial plastic surgery, and even more specifically, really focusing primarily on the eyes, although I do cover other areas of the face as well. So it's a long training, but there's a lot of detail that needs to be learned. There are a lot of different facets to the specialty, and so it takes time to get as specialized in this area. I used the 3 years of training for different aspects of my specialty. So some people only do 2 years of specialty. I actually did an additional 3rd year in cosmetic facial procedures as well. So the initial 2 years, I did learn some of the more basic oculoplastic procedures. But in that 3rd year, I focused primarily on cosmetic and facial plastic surgery as well. So I used every bit of that 3 years for sure, and I still use all of that training today for anywhere from the medical procedures, but also in the cosmetic aspect as well. I'm very happy to be living in Charlotte. I've been here for 8 years. My time that I spent in Los Angeles really helped me with not only my training, because I was able to train at really some of the most premier places in the country for not only cosmetic surgery, but also reconstructive surgery, which is a big part of my practice. What I learned in Los Angeles really, I think, has been applicable throughout my practice, and I've adapted really to my move to the East Coast by bringing those things that I learned there and adding some new things that I've learned. The patient population is different. Sometimes I need to take into account a patient's lifestyle or their medical history or their expectations. And so I think having as much experience as possible all over the country has been really helpful for me. So I'm not blocked into just one way of thinking. The Los Angeles crowd is often very, very savvy about plastics, especially cosmetic procedures, and sometimes that can be tough because a patient may ask for something really specific, and it may not actually be the right choice or the thing that I would recommend. And so I learned a lot about how to advise patients to do the safest choice, even if they came in thinking about something else or wanting something else. And I use that a lot actually in this practice. Sometimes my patients around North Carolina, at least this particular location that I've been working in, I've noticed they don't really have anything in mind yet that they want. They just know what they want fixed, and I'm able to help use some of my experience to help guide them directly.